Hi, folks. Welcome. And I am Dr. Ed Beyer. I am the clinical director of Beyer Stem Cell Institute in Tinley Park, Illinois. I practice what's known as functional medicine. I've been doing it for over 30 years. What I mean by that is I take people with chronic illness, people with hormone imbalances, fatigue, digestive issues, autoimmune diseases, all these various things, type 2 diabetes, and I try to get them better naturally. I have added to my practice the Stem Cell Institute. Now, there's a lot of hope and there's a lot of hype about stem cells. And I'm going to tell you today the right way to do it, what it is good for, what it may be good for, and what it's not good for. So not everybody is a candidate for this. In our clinic, we use it for one thing and one thing only, is we do proper stem cell therapy for people with broken down degenerative joints. Whatever the reason for that is, that's what we use it for. In all my 31 years of being in practice as a functional medicine type doctor, I have never seen a more effective natural therapy if it is done properly, because there are a lot of people out there not doing it properly. Now, the way that I like to teach is I'm going to tell you what I'm going to tell you, and then I'm going to tell you, and then I'm going to tell you what I told you. All right, because I like to hear things over and over and over, but there's going to be a few points that I really want you to take home, and I will repeat those points. So, regenerative medicine, and the way that I got into this, it's an actual personal story, and it starts with this man right here. This is my father, Ray Beyer, and this is him in 1953. He had just returned home from the Marines, so you can kind of see that I was raised by a Marine, and those of you watching this that know a Marine or are a Marine, those are people that are very direct, and they like to do things properly. And so there was one thing that my dad taught me growing up, and I have 4 brothers and a sister, and we did not like hearing it when we were young, but he used to teach us, if you're gonna do a job, do it right. And when it comes to stem cells, that is absolutely a deal breaker. You have to do it properly, otherwise it will not work. Today, you're going to learn how to do it properly, whether you come see me or go see someone else that does this. Now, here's my dad, 1953, just got home from the Marines, just got engaged to my mother, and just started his apprenticeship in Local 130 Plumbers Union. The other thing about my father is he was the hardest working man I've ever met, always working and worked with a smile. Now, here is my dad on December 1st, 1999. It's his 70th birthday. Because my father worked so hard, at this time in his life, he had bone-on-bone elbow, he was a left-handed plumber, and bone-on-bone knees from bending down on cold Chicago floors and soldering pipe and doing things that plumbers do. Now, at this time, we did not know it, but he began taking a prescribed medication by his medical doctor known as Vioxx. Now, some of you may know this and some of you may not know this, but Vioxx was an FDA-approved medication, and it ended up killing or causing over 60,000 fatal heart attacks. And my father was one of them. So, 10 months later, this is a picture of me with my father in October of 2000 with my youngest son, Scott. And my dad raised me well. He raised me a White Sox fan. We are Southsiders. I'm from the south side of Chicago, 81st and Hermitage. Some of you may know where that's at. And here he is. I flew him in. He was retired in Utah. And we were getting ready to go to see the White Sox. And, of course, they lost because they made the playoffs when they lost that year. And this was the last day I saw my father. You have to understand, folks, at this time in 2000, I had been in practice 12 years in a functional medicine practice. And when this happened to my father, and we knew the cause of it was that medication that he was on, I made it my mission, and I vowed that I will find the best natural therapy out there for joint arthritic pain. And at that time, I started researching stem cells. And it was in its infancy, and I did not feel comfortable at that time using what was available then. Now, in 2008, they discovered a source of a particular type of stem cells known as human umbilical cord cells that contained the particular stem cells that actually regenerate joint tissue. Then I became more interested. Took a few more years for the research to catch up. Now it is, right now the verdict is in. We know for sure, the science shows that stem cells done properly will regenerate and regrow cartilage, ligaments, tendons, and all the different tissues that are in joints. So what are we going to cover today? We're going to cover exactly what are stem cells and what do they do, because there's a lot of confusion out there. And what type of stem cell and the source of that type of stem cell is absolutely crucial for joint regeneration, because there's a couple ways that's being done, and there's one that is the best. We're going to compare stem cell joint regeneration to standard medical care that most people out there get, pharmaceuticals, other types of injections like corticosteroids, and joint replacement. And then we're going to talk about stem cell research, because there's a lot of it, but I'm going to show you exactly where to look for that. Who is actually doing regenerative medicine with stem cells? Who's actually doing it? You're going to be shocked at some of the major institutions and hospitals that are doing this already. Stem cells in the FDA and Big Pharma. Are they in? Are they out? If so, what is the deal with that? And could it be right for you? Because it is not right for all people. And I will cover that also. And then we're going to cover cost of regenerative medicine. And I just give that to you right out and open in the table. We'll do that at the very end. So what we're talking about is pain, and we're talking about a particular type of pain, arthritic pain. And the Center of Disease Control did a study in 2013, and it said that 1 out of 2 of us, 50%, will at the age of 65 have at least one joint that is totally messing with our lives. Now, I love words, and the word arthritis comes from a Greek word arthros, and arthros means joint. And please understand, there's multiple different types of tissue in the joint besides cartilage, because everyone thinks of cartilage right away, and that certainly is a type of tissue in the joint, but not the only one. When your joint degenerates through an arthritic process, it's not just the cartilage that degenerates, it's the ligaments, it's the tendons, it's the muscles, it's the bone, it's these fat pads called bursa sacs that are also degenerate. And there's one in particular in the knee. When it degenerates, it actually has a special name to it. It's called a Baker's cyst. We see that a lot. Now, itis means inflammation, and inflammation means to ignite. So arthritis means the destruction and degeneration of cartilage, ligaments, muscles, tendon, bone, and fat in our joints. Now, there are basically 3 different ways our joints can break down, and it doesn't really matter which way you may have. The end result is the same. We have injury. Like, for example, I injured my lower back playing high school football, herniated 3 discs. So that area of my body's never been quite the same. It's a weak link. Then there's number 2, repetitive trauma. That, I think, is the most common. Like my father working a pipe wrench on his left arm for 40-something years, or bending down on his knees on cold floors. Then there's autoimmune diseases that can attack our joints, where the immune system attacks our different tissues in the joints. Things like rheumatoid arthritis, psoriatic arthritis, lupus, scleroderma can be one, ankylosing spondylitis. But whatever the cause, the end result is we don't move, we lose our independence, and we're in pain. Now, I always like to talk a little bit more about pain, because we know pain is no fun to experience, but what a lot of people don't know, that pain is extremely toxic to the brain. And in order for you to understand this, I have to kind of give you a little neurology lesson. And here's how I'm going to do it. If I was to tap my left hand and were to ask each and every one of you here today, where am I perceiving this? Most of you would say in your left hand, and that would be inaccurate. I'm actually perceiving it in the map of my left hand in an area of the right side of my brain. All sensory perception does not occur in the body part. It occurs in the brain. Because I could put my brain under anesthesia and cut this hand off and not feel anything. So pain is perceived. Pain is not pain until it hits the brain. Now, if you are in constant pain, or in pain half of the day, or however many hours you are in pain, there are areas in your brain that are working overtime. And when areas in your brain work overtime, they start to fatigue. And then you're going to start to get certain neurological symptoms that you would never attribute to pain. Things like depression, anxiety, memory loss. A big one is insomnia, right? So when pain hits the brain, it hits a particular part of our brain that is our wake center. One of the biggest things we see when we do these stem cell injections and we get people out of pain, I do an 8-week follow-up. And in that 8-week follow-up, one of the things most people are grateful for is I am sleeping through the night. Because let me tell you, from a functional medicine perspective, when you don't sleep, you will never, ever, ever be healthy. It's like not charging your cell phone battery. You're going to have fatigue. You're going to have brain fatigue. You're not going to be able to remember things. You're going to have memory loss. Your chances of neurodegeneration skyrocket, like Parkinson's syndrome, Parkinson's disease, and Alzheimer's. You're not going to be able to read things. You fall asleep when you read. You can't concentrate. You drive a car and you get tired because driving a car requires a lot of ocular reflexes, and that requires energy. So the big guy starts to go south on us. Also, when we are in constant pain, pain hits the part of our brain that's called the fight and flight center. And when that part of the brain is activated all the time, fight or flight, it's like you are in fear all the time. So your blood pressure goes up, your blood sugar goes up, sexual function goes down. So there are many, many, many concomitants to pain besides the fact that it just doesn't feel good or it makes you immobile and not as dependent as you want to be. Now, so we have this type of arthritic pain. We go to our family doctor, and guess what you're going to get? Pain and anti-inflammatory medications. Or they may offer certain types of injections, which we'll talk about. And then there's surgery, usually joint replacement surgery. But now, folks, the purpose of this seminar, the purpose of this lecture, is to let you know we now have this whole other option called regenerative medicine, if it is done properly. And this is, in all my years, I've never seen something more successful. So let me try to give you my south side of Chicago, blue-collar, marine-raised way of describing stem cells, okay? So when we're fully formed, when we're born, we are made up of 210 different types of cells. Like our neuron cells are very different than our muscle cells. My pancreatic cells are very different than my bone cells. So each one of these cells is very, very different, and they have different functions. But it's not that way when we're created. When we're created, we got mom's egg and her DNA, and we got dad's sperm and his DNA, and they join forces and they form one cell, and that's called a zygote. And that occurs in the fallopian tube. Within about 7 to 9 days, that one cell becomes a clump of cells known as a blastocyst, and that's in the fallopian tube. Now, these 50 to 100 cells in the blastocyst, each one of those cells has the potential to become any one of those 210 cells that make us up. And that's amazing. Another way of putting that, the 210 cells that make us up when we're born and the rest of our lives, they all stem from those original cells. Now, those are also called embryonic stem cells. They're called pluripotent cells because they are pluripotent. They can become any one of our 210 cells. Folks, I'm just going to say this right now. We don't use those embryonic cells for joint regeneration. In fact, you cannot. It's illegal. Those cells are used for research. And I'm going to tell you, they are discovering and are going to discover the solution to a lot of chronic illnesses with those cells. But that's not what we talk about with joint regeneration. So these early 50 to 100 pluripotent stem cells, they're going to do one of two things. They're going to start differentiating into one of those 210 cells. Some of them are going to become nerve cells, some muscle cells, some pancreatic cells, some bone cells, etc. That's called differentiation. And in order to form a full human, that takes about 40 weeks. And that happens in the uterus. Then some of these pluripotent stem cells are going to go through a process called derivation. And what that means is some of those cells are not going to differentiate into those 210 cells that make us up. They're going to become more mature adult stem cells. And I'm going to tell you why that's important. By the time we're born, 1 out of 10,000 of our cells is a mature adult stem cell. Why? Why are we created that way? because the purpose of stem cells is to repair damaged tissue or cells. Every time we injure ourselves, and every time we want to grow other tissue, or any time we have a disease where cells are destroyed, they release chemicals into the bloodstream, and these adult stem cells pick up on those chemicals, and they will go to that area and they will heal it. And you're thinking, wow, well, we already know this. Who's ever had a cut in here? Okay? If you cut yourself, you fully expect that skin to heal, right? But it's stem cells that are doing that. All right, that's what people, they go there and they repair that. So the adult stem cells, their purpose is to repair and regenerate any cell tissue that are damaged due to injury and disease. We fully expect that. We understand that concept. The problem is this, and this is the reason why you're here today and why you may be listening to this. This is important, and you need to remember this. As we age, the number and the potency of those adult stem cells decrease dramatically, and our degeneration increases. So our ability to keep up with degeneration is greatly diminished as we age. We all know this too. Who's going to heal quicker? A 6-year-old that breaks an arm bone or a 60-year-old? And the answer is obvious. It's going to be a 6-year-old, because a 6-year-old has more potent and more in number stem cells to do that healing. That's why when I do these lectures and these seminars, I never see 20-year-olds in here. I always see older people. So we degenerate quicker than we can regenerate. That's very, very important that we understand that. So these adults, now there is a certain type of adult stem cell called a mesenchymal stem cell. And these are the stem cells that repair joint tissue. And these are also very anti-inflammatory, and they modulate our immune system. Now, in our own body, we have these joint repairing stem cells called mesenchymal stem cells. They reside in our bone marrow, and they reside in our fat tissue. So that if we twist an ankle, wrench a knee, they're there to repair it. Now, what we also found out early in 2008, and this is when my interest got piqued, is there are mass quantities of these mesenchymal joint stem cells found in an area of the human umbilical cord called Wharton's jelly. Wharton was an English guy in the 1600s who spent his life looking at umbilical cords. These cells are the best and easiest source of joint regenerating mesenchymal stem cells. Now, I make a point of that right away because there are doctors out there that are doing stem cell therapy for your bad knee, your hip, or whatever, and the way they're doing it is they put a needle into your hip bone, iliac crest, and they pull out your own mesenchymal stem cells and they inject it into the joint. And that does help some people. But those cells are not nearly as strong nor nearly as powerful as the human umbilical cord cells. And I'm going to mention that again later, but remember, I promised you I'm going to tell you the exact best way to use stem cells to regenerate your joints. And I'm doing that because I was raised by a Marine who taught me, if you're going to do a job, do it right. That is the best way. The other way is a little kind of archaic. So the best source of mesenchymal joint repairing stem cells is from Wharton's jelly. And the way of obtaining those stem cells is all FDA regulated, and we're going to cover that later. Now, Wharton's jelly, this tissue that we get, also contains other proteins and anti-inflammatory chemicals called exosomes, which help the stem cells to work better. So now, this was my dad's favorite movie, The Good, the Bad, and the Ugly, 1968, I believe, with Clint Eastwood. And we're going to compare mesenchymal joint repairing stem cells to other options that most of you get when you go to your doctor: cortisone injections or corticosteroids. Now, these medications and these injections are absolutely beautiful and wonderful and work very well for reducing inflammation. But at what cost? These chemicals actually break down bone. They actually break down cartilage. They actually break your joint down. Do you know what I hear all the time? Hey, doc, I got this cortisone injection in my knee, and it worked like 6 months, and then it wore off, and I got another one. And then it only worked for 2 months, and then I got another one, and it didn't work at all. Because every time, folks, this is just physiology 101, every time you put corticosteroids into your joints, you are destroying that joint. You are temporarily relieving inflammation, but you're destroying the joint. Not only do these corticosteroids and prednisone destroy joints, but they also break down the gut barrier, causing something known as a leaky gut. They raise blood pressure, they cause cataracts, they thin our skin, and they disrupt our body's own cortisol rhythm, leading to weight gain and poor thyroid function and insomnia and blood sugar problems. I just read a study that said this, and this is a study, that if you take prednisone for 10 days, your chances of osteoporosis go up 270% the rest of your life. If you take prednisone for a year, and a lot of people with COPD and chronic lung problems do, if you take prednisone for a year, your chances of osteoporosis go up 21,000%. This is right out of MayoClinic.com. Cortisone eats your joints. That's why your doctor will only do so many of them. Now, then we have the non-steroidal anti-inflammatory medications: aspirin, ibuprofen, Aleve, Celebrex, meloxicam, and there's many others. Stomach ulcers, it breaks down stomachs, it breaks down gut barrier. In fact, another study said that 10 to 20,000 deaths per year are attributed to the proper use of these non-steroidal anti-inflammatory drugs. And by the way, my father was killed by a non-steroidal anti-inflammatory drug, Vioxx. And the end story of Vioxx is Merck, the manufacturer, had to take it off the market. Obviously, it was killing people. And they settled a class action lawsuit for $4.84 billion. And you know what? That was just a little check to them. My family was not involved in that. They did not want to get involved. Causes high blood pressure, kidney, liver disease, digestive dysfunction. And then there's Tylenol, acetaminophen, liver damage, this digestive dysfunction. And then there's the opioids. And we know we got an opioid crisis, right, in this country. So, and I'm telling you, more than 50% of the people that get addicted to opioids start out this way. So we really don't need to get into the side effects of opioids. Now, I love this quote right here. We are not made of drugs, we are made of cells. This is a natural cellular therapy. That's what I love about it. We're putting donated, healthy human umbilical cord, joint repair and stem cells into your joints to regrow the tissue. Now, I'm going to ask you all here today a question, and you're going to answer it in your own head, and it's going to take you 5 seconds. That's because it's easy, all right? I'm going to ask you, what are 2 changes that you can make in your life right now that would make you healthier? Everybody got it? Don't say it out loud. Everybody got it? Now, I want to ask, did anybody in here think, you know what, I think I need to take more medication? And I never get people saying that. And what are you going to get? You go to your doctor. Here's the status of our healthcare system in the United States. The United States represents 5% of the world's population. We consume 72% of the world's pharmaceuticals. Now, please don't misunderstand me. I'm not against pharmaceuticals. There's definitely a need for them. But when you got 5% of the world consuming 72% of them, and we're 48th in longevity and morbidity, and we spend more money per person on healthcare than any other country, that's a problem. This is a pharmaceutically driven system, folks. And if all you have is a hammer, every problem's a nail. You go to your doctor, that's what you're going to get. Big Pharma controls our healthcare system. Just turn on the TV, and I guarantee you, within an hour's time, you're going to see a commercial for a pharmaceutical. So here's the other situation. Big Pharma controls insurance reimbursement. So I'm going to give you a message. Please don't get mad at the messenger. If you want quality healthcare, natural healthcare, your insurance is not going to cover it. Why would a pharmaceutically driven system pay for something that's going to get you off the pharmaceuticals? It just does not, and in my opinion, will never work that way. And should you care, No, because my health insurance doesn't cover my car, yet I use that. My health insurance doesn't cover my cell phone, my vacations, my kids' education. We live in this thing, our amazing body, 24 hours a day, 7 days a week. My opinion is if I got a broken down knee, hip, back, and there's something that's going to make that better, that's where I'm going to put my money. So don't kill the messenger, but that's just the way that it is. Now, if you don't believe me, look at this next slide. Medicare Guidelines, Section 2251.3, a treatment plan that seeks to prevent disease, promote health, and prolong and enhance the quality of life, or a therapy that is performed to maintain or prevent deterioration of a chronic condition is deemed not medically necessary. And when I read that, I get this gasp sometimes. But I show this just to prove a point. And Medicare is the template for all insurances, Blue Cross, United Healthcare. So this is just the way that it is, like it or not, pharmaceutically driven. Now there's other injections that we can get besides corticosteroids. Some people are familiar with them. I'll go through them quickly. Prolotherapy is dextrose, sugar. They'll do multiple injections in your bad joint. Then there's Synvisc or rooster comb or hyaluronic acid. It goes by a bunch of different names. There's a lot of orthopedic surgeons doing this. Then there's PRP or platelet-rich plasma, where they take the platelets out of your blood and they inject it into your bad joint. And I will tell you, this helps a lot of people, but here's the key word, temporarily. They don't actually regrow tissue. So these types of injections, it's like if you have a bad lawn and you got dirt and a little bit of brown grass and some green grass, this is like fertilizing it and watering it. Where stem cells is like putting new grass seed in and then fertilizing and watering it. And then we have surgeries, right? Shoulder replacement, knee replacement, hip replacement. I cannot tell you how many people that come up to me after these seminars, and I'm scheduled for that. I am totally scheduled. And what should I do? I'm like, well, I'm sorry, if it were me, I would do this first. So we know that with these surgeries, that there's a lot of downtime, 3 to 6 months usually for rehab. I had it done on my knee, stem cell therapy, and that day I saw patients the rest of the day. The next day I went to the gym and did my normal routine. And after a while, about 6 to 7 weeks, my knee just gradually got better. Now it's pain-free. And with surgeries, 50% need a second one. And there's a lot of cost of time and rehab and all of that, pain and money. So what do all these medical status quo treatments have in common? None of them regenerate tissue. So regenerative medicine is healthy, donated, and FDA-regulated human umbilical cord mesenchymal stem cells. I know that's a mouthful, but that's what it is. And growth factors are administered to repair, reconstruct, and replace damaged and degenerated joints. It's the most amazing thing I've seen in my 31 years in practice. Now, regenerative medicine versus mesenchymal stem cells, and the good and the bad. So I'm going to do a little bit of a review here. So mesenchymal stem cells, remember, there's different types of stem cells. We have stem cells for skin, for bone, for heart, for brain, and then we have them for joints. Mesenchymal stem cells are the ones used for joints. They're primitive cells that they're going to do one of two things. They're going to differentiate into joint tissue, cartilage, muscle, tendon, synovium, fat, bursa, all that, and then they're going to self-replicate. And that's important because when we do our injections from a company called Predictive Biotech, their product contains 1.1 million mesenchymal stem cells, and that is assured by the FDA. But you need trillions of these cells to actually regenerate your knee. So when we inject or hip or whatever joint, knee is the most common one we see. So when we inject the joint, 1.1 million become 2.2 million in about 28 hours. And then at 2.2 million become 4.4 million in the next 28 hours. And so on, because you need trillions to actually regenerate joints. So they self-replicate. So our bodies are self-healing machines, and they use stem cells as their own internal repair system. So any type of healing is a stem cell event. We've heard of lizards, right, that lose limbs and then their limb grows back. What are those? What's doing that? Stem cells. We just don't have those type as humans. They do. But the problem is as we age again, our stem cell amount goes dramatically down, and so does the potency, so our ability to regenerate diminishes. But now we have a source of joint repairing stem cells that works beautifully. So here's an x-ray of an actual patient. 63-year-old gentleman came to me ready for surgery. You can see the before, and that is a knee. You can see that, and it's bone on bone. So we did one properly done human umbilical cord mesenchymal stem cell injection. Now this is where when I do these seminars, when I say certain things, what I feel coming off of you is you barely believe me, but I am telling you the truth. One injection, and now look at his x-ray 8 months later. That is a regenerated knee. And people are like, wow. But then when I say, well, what if you cut yourself? Would you expect it to heal? Oh, yeah. Well, that's all this is. That knee was regenerated by using regenerative cells, stem cells. Stem cells regenerate tissue if it's done properly. Now, the idea of using stem cells is not a new one. The idea of using stem cells to regenerate tissue is not a new one. One of the things that most people are familiar with are bone marrow transplants. What are those? That's stem cells. The first one was done over 40 years ago, 1973, Sloan Kettering Cancer Hospital. An individual had leukemia. They did chemotherapy, and when they did the chemotherapy, they killed the cancer cells, but they also killed all the blood-forming stem cells. And those are called hematopoietic stem cells. Now this person could not produce red, white blood cells and platelets. So they took bone stem cells from a donor, injected them into this individual, and boom, she started making her own blood cells. And then skin grafting. We get a bad burn. All the skin is burned, and so are the skin stem cells in that area. So they graft skin from another area along with those skin stem cells, and they graft it. So now they've just perfected it for joints. And you're going to find in another 5-10 years, people are going to know about this like they know about bone marrow transplants. Stem cell therapy is also well researched. Now what you want to do, folks, is you don't want to go and Google stem cells. That's like wanting to go to downtown Chicago, you don't know where you're going, and you ask for a map and someone hands you a globe, okay? You got to get more specific. So what you do is you go to PubMed.com. It's the most respected search engine. This is what we look at. And you want to Google, or not Google, but you want to punch in the keyword mesenchymal stem cells and joint regeneration. That's what you want. And all of what you're going to find is extremely positive. And don't be that person that's going to, I'm going to go to my doctor and ask my doctor. I'm just going to tell you straight up, most of them, and when I say most, like in the 90%, know nothing about mesenchymal stem cells and joint regeneration. But if you say, hey doc, what do you think of stem cells? Don't do that, because doctors suffer from a thing called ego, and they're going to have an opinion on something they know nothing about. So they're going to go, I don't know, the research, Here's what you want to do. Hey doc, tell me what you know about mesenchymal stem cells and joint regeneration. And if that doctor has the deer in the headlight look, they know nothing. Because if they are looking it up, you're going to see right away their eyes are going to get big. And you know what? Yes, I've looked into it, and it's very promising, because it is. Do it yourself. Here are some studies that I put on the presentation here that you can look up. Mesenchymal stem cells for cartilage repair and osteoarthritis. Umbilical cord as mesenchymal stem cell source for treating joint pathologies. And these are like 7-8 years old. This isn't like a new idea. Even the National Institute of Health is spending more and more money on stem cell research. And now check this out. Even the Mayo Clinic is doing this. The Mayo Clinic has a fantastic reputation. They're not going to do something that is iffy or nefarious, okay? So I took this right off their website. They use stem cells for knee arthritis and also for hip and some other things. So one of the biggest institutions and most respected in this country is using this. Proper mesenchymal stem cell injections work for orthopedic arthritic conditions. Now look, you're going to find some clinics out there that are going to say, oh, you can use these for macular degeneration, or you can use these for COPD. Well, I personally am not comfortable because there still needs to be a little more research done for that. I want to make sure that when people pay good money for these cells, that it's done right and that it's done for a condition that we absolutely know it works for. So we use it for knees, hips, shoulders, neck, low back. I've had it done in my thumb joint right here. It worked fantastically for me. Elbows, wrists, ankles, and feet. So what do I mean by proper stem cell injections? You got to use a lab that is FDA registered and regulated, because there are labs out there that are not, and bad things have happened. And those are the ones you see on the Channel 2 News and all of that, okay? And they should be reported. Unfortunately, though, that when we have these people not doing it right and people see it, they think that all of it's bad. So has to be an FDA registered and regulated lab. I'm going to show you in a little bit how you can know that for sure. And then the injection must be done ultrasound guided, because your doctor needs to see where to put these cells. If any of you out there have ever had a cortisone injection or any type of joint injection without ultrasound guided, your doctor was either lazy or cheap. If you're going to do a job, do it right. So stem cells, the bad is we produce less stem cells as we get older. We already mentioned that. And here's a graph that shows that when we're born, 1 out of 10,000 cells in our body is a stem cell waiting to repair. And then as a teenager, that number goes down to 1 out of 100,000. And then at age 30, it goes down to 1 out of 250,000 of our cells is a stem cell. Age 50, 1 out of 400,000 goes down is a stem cell. And by the time we're 80, 1 out of 2 million. This is why we deteriorate. And not only do they go down in number, they go down in potency. So this beautiful baby has 1 out of 10,000 of his or her cells are stem cells. And remember, stem cells self-replicate. And one of his or her cells is going to become a new stem cell in 28 hours. So what that means is by the end of a month, he or she's going to have 1 billion new ones. Now, Tom Brady, he's about 40. So his cells replicate every 48 hours instead of every 28. So if you do the math on that, he's only going to have 32,000 new cells per month. By the time we're Medicare age, they replicate every 60 hours. So now this person or people at Medicare age only make 200 new stem cells a month. This is why, folks, when you go and you get stem cell injections for your joints, you don't want them coming from your own body because they don't replicate. I'm 60. Why would I want to use 60-year-old stem cells that are going to replicate every 60 hours when I can use brand new human umbilical cord stem cells that replicate every 28 hours? Because you need them to replicate. That is extremely important, and that is how you got to do this right. So there are basically 2 sources of stem cells, 2 types. We have embryonic stem cells. Those are the ones that we talked about at the beginning of the seminar in the blastocyst, the pluripotent. And then we have adult stem cells. Now, adult stem cells can either come from your own body or they can come from a donor. Now, this is where people get confused. Human umbilical cord stem cells are adult stem cells. They're not embryonic. They're adult because the baby's fully formed. And a lot of people get confused on that. Now, embryonic stem cells can come from the death of an embryo, folks. That's not being done. All right? It's illegal, immoral, and unethical. No one's doing that. Because I get posts on my Facebook page saying, how many babies do you kill for your stem cells? That's disgusting. Don't be that person. Those cells are not being used. What are being used for research are embryonic stem cells obtained from in vitro fertilization labs. This is where a couple can have a baby. Mom donates about 6 to 8 eggs. Dad sperm, they put it in a petri dish. They take the 1 or 2 that look the best, implant them in the mother's uterus. And what do they do with the other ones? President Bush and President Obama have passed laws allowing research on these early embryonic stem cells. And there's some promising things. But that's not what we're using here, folks, okay? Then we can take stem cells from our own body, and this is important because it clarifies a lot of things that where people are confused. You can take stem cells from your own body, that's called autologous, and you can take them to a lab and you can manipulate them. You can change them. I call it adding fertilizer to them. And that now the FDA considers those are not natural anymore. They're considered a drug, and it's a non-FDA approved drug in the United States. So lab manipulated stem cells from our own body we cannot do legally in the United States, but you can go to Panama, Mexico, Europe, and get this done. And a lot of Hollywood stars and athletes Walter Payton did it. Bart Starr had this done. So this has been done, for those of you who know who Bart Starr is. So this has been done for a while, and it works. It's very, for a lot of people, but very expensive. It can cost anywhere from $50,000 to $100,000. So the rich and famous get that done. Then you can take your own mesenchymal stem cells and inject them into your own joints without manipulating them. And that's what's being done by a lot of orthopedic doctors. But those stem cells are weak. They don't replicate quickly enough. That's why human umbilical cord stem cells is the only way to do this properly. So here we see allogenic, which means donated, from healthy human umbilical cord tissue. Wharton's jelly contains mass quantities of brand new, fresh human mesenchymal stem cells. And it also contains hyaluronic acid and all of these special proteins that we need to help regrow the tissue in our joints. The other thing that's really important, and I get this question a lot, and it's a really good question, is these mesenchymal stem cells from human umbilical cord, they are immune privileged. What I mean by that, you don't have to match like you do with blood. You can inject them into anybody, and no one will ever have an immune response to them. There's no rejection. So the company that we use, Predictive Biotech at this moment, their products have been injected in over 50,000 people, and there's never been an immune response. We've done hundreds in our clinic, and there's never been an immune response. Now, even though I say that, people are going to still ask me that, but I still have to say it. So here we see right here, this is Dr. Hanlon, our doctor right now who does our injections in our clinic in Tinley Park. And you'll see in his hand that he has a product called Coresight. And this product is from our lab, Predictive Biotech. And you can see there's a number on there. That's called a lot number. If you go and get stem cell therapy, and if the doctor does not pull that product out of a cryo freezer, you need to run out of there as fast as possible, because those aren't going to help you. You're going to waste your money. And if you don't see a lot number like that, then that is not from an FDA-approved lab. The FDA requires that these products have been inspected, they've been tested, and they've been screened so that they are what they are, and they put a lot number on there. And then when they send them to us cryogenically frozen, they go into our cryogenic freezer, and this is Dr. Hanlon actually pulling it out right before an injection. It thaws in like 3 minutes. And then he has to take that lot number, send it back to the lab so that we can trace where these cells came from all the way to whoever got injected. And these contain 1.1 million potent and viable mesenchymal stem cells. This is an FDA-registered lab. The FDA oversees all this. That's how you know, by the lot number. So the way this works is when a mother is having a hospital birth, they're going to be asked at the 7-month point, do you want to donate your birth tissues, the placenta, the umbilical cord, amniotic fluid, to a tissue bank and a blood bank, just in case the baby may need cord blood or different tissues if there's something wrong with the baby. Most mothers are like, why not? So then the mother is screened. She's asked all these questions. Have you ever had AIDS? Have you ever had hepatitis C? Have you ever been in this country during these years? The same questions were asked when we donate blood. So the mother is screened. Then when the baby's born, baby's fine, these tissues and blood go to the American Association of Tissue Banks, American Association of Blood Banks. Just like when we donate blood, it goes to a blood bank. And there in a blood bank and there in these tissue banks, the National Institute of Health requires sterility testing to make sure that there's no infectious diseases and that everything's clean. And then Predictive Biotech can order these cells, these tissues, these stem cells from the tissue bank and blood bank. And then FDA requires about 8 steps that this lab has to do so that we know whatever's in that product is in that product and that it's viable and it's going to do what they say it does. Very important. Mesenchymal stem cells, folks, is the only option available to us to regenerate and regrow joint tissue. Now, after the FDA approval from the lab, they have to be cryogenically preserved and then shipped cryogenically frozen. Otherwise, those cells will die. As soon as they come into our office, they come out of a cryogenically frozen box into our cryo freezer, and they're thawed right before the injection, and they are always done via ultrasound guidance. On average, these cells will divide every 28 hours for 65 generations. People always ask, well, how do they know when to stop? When the area is healed, okay? Like, how do your skin stem cells that repair cuts, how do they know when to stop? When all the cells are healed. And so then it'll know. Now, at 8 weeks, I meet with the patient because then it's time to get them going on exercises. Now, I have a daughter who's a physical therapist, and she's like, yeah, Dad, these doctors send us people with bone-on-bone knees and hips and spine, and they're like, exercises make them worse. So what we do is we do the injections and we allow for 8 weeks of regeneration. Then we get them going on the exercises. So timing is very, very important. Big Pharma, stem cells into Big Pharma. Okay, here's the deal. Big Pharma can only make money on things they can patent. You cannot patent something that's natural. If Big Pharma had its way, they'd be patenting apples. They'd be selling them to us for $500, and our insurance would cover $499.99, and you're like, my insurance is awesome. I got this apple for a penny. They can't patent natural things. So there's no money for them to be made in stem cells. That's why they're not into it. And let me tell you, Big Pharma has to make a lot of money. There has to be a pot of gold at the end of the rainbow because they're going to spend a lot of money on research, clinical trials, and those commercials that you see are not cheap on TV. So that's the reason why you have to come to a seminar like this or watch it on my website to learn about it. Umbilical cords and the FDA. Folks, this is a natural treatment. The FDA does not approve, nor does it disapprove natural therapies. It's a federally funded agency that looks at foods, drugs, and medical procedures. That's it. So the FDA does regulate how these cells are housed and processed. So people get hung up on this all the time. The FDA didn't approve my car, but I used it to come here today. Doesn't approve my clothes, but I wear clothes. So they look at food, drugs, and medical procedures. That's really, really important that you understand that. And there is no insurance coverage for natural therapies. Why would a pharmaceutically driven system cover something that's going to get you off the pharmaceuticals? Now, I'm going to drive this point home. I'm going to share with you some actual patients. This is a patient of mine, Pearl. Pearl is 62 years old, and she sent me this picture because I had helped one of her friends in our functional medicine part of our practice. And I remember her email. She had told me all these different things that were going on with her. She had thyroid problems. She had Lyme disease, all these different type of issues, digestive issues. And she had tried 6 or 7 different FDA-approved therapies. And she wrote at the bottom of her history, Dr. Beyer, I hope you can help me because all I want to do right now is meet Jesus. She literally wanted to die. Now here's Pearl 4 months later. And let me tell you folks, everything we did for Pearl was non-FDA approved. So we need to get out of our heads that just because the FDA doesn't look at something, it doesn't mean that it can't be efficacious and we can't benefit from it. Here's another patient, Kermit, came to us with psoriatic arthritis, psoriasis, and eczema. And he had tried about 6 or 7 different FDA-approved medications. to no avail. And here he is 6 months later. Here's the plaques on his leg when we started, and here's his leg 6 months later. He had parasites in his intestines. He had adrenal dysfunction, so he wasn't producing a certain hormone that helps the immune system. He had food sensitivities, and so on. Things that traditional medicine doesn't look at. With functional medicine, we don't care what you have. We want to know why you have it. And I'm telling you right now, the reason why you have a broken down joint or joints is because you have a mesenchymal stem cell shortage. And now we have a source where we can use them and put them into that joint and repair it and get your life back. Are there side effects of human umbilical cord stem cell? A small percentage of people will get, like 1 or 2%, will get flu-like symptoms for a day. Now, I personally have never had that happen in my clinic, but the lab makes us say that. Who would we not do this on? We would not do it on someone who already has a total joint replacement because it won't work so well, and so why do it? If you're going to do a job, do it right. Or if there's an active infection in the joint that we want to do it into. Not anywhere else in the body. If you have a cold or a flu, you can go ahead and have it done. But if you had an infection in your knee, we would not do it in your knee. If you had an infection, like a fungal infection in your foot, we would not do it on your foot. We would not do it on someone who's pregnant or planning a pregnancy within 4 months. We would not do it on someone undergoing active chemotherapy or cancer treatment, active chemotherapy or active cancer treatment. And if you're diabetic and your A1C is above 8.0, we won't do it. You're too inflamed. We want to make sure that, if we're going to do this on someone, that you have a good and excellent chance for it to work. How many treatments? Now, this is, again, where I feel coming off the audience, they barely believe me. 1 in almost all cases. 1. I know you guys are all used to multiple corticosteroid injections, but none of those regenerate. We're putting into your joint millions, and then they replicate. And then they're going to be able to restore, just like you saw in that before and after x-ray. And this is more the reason why you need to use brand new umbilical cord stem cells because they replicate every 28 hours versus mine would replicate only 60 hours. How long does it take? The procedure, 5 to 20 minutes. I don't do the injections. Dr. Hanlon in our clinic does. I'll think his picture's coming up soon. Will this affect my DNA or my genetics? Absolutely not. Only viruses and carcinogens will affect your DNA. This is Dr. Matthew Scott Hanlon. He's out of a little company in Mary. He's the one who performs the injections in our clinic in Tinley Park. He's been doing joint injections for over 20 years. Corticosteroid injections and different things like that. Look, a joint injection is a joint injection is a joint injection. Whether it's corticosteroids, stem cells, it's the same procedure. But these are done ultrasound guided, so he knows exactly where to go. Many people come to me, well, don't you need to take an x-ray or an MRI or a CT scan? No, because if we already know the joint is degenerated, when he does the ultrasound prior to the injection, he's going to see the amount and where those cells need to go. Again, if you're going to do a job, do it right. So how long will it last? How long will it last? Well, let me ask you this. If you had a tire on your car that was worn out and you went in and replaced it, how long will that tire last, the new one? Probably as long as the old one, depending on how you drive. So, this is going to last years. How long did it take to get your knee, your hip, your back, your shoulder to degenerate? Years. Trust me, by the time you feel pain in a joint, it has been degenerating for many, many years. Does it hurt? It hurts like when you get your blood drawn, except hands and feet. When I had it here, it was a little painful, but he uses numbing spray and it's not that bad. Okay, how fast will we see results? About 15% see results almost immediately. But the majority really starts seeing the results by the 8th week. But sometimes not even then, right? Most of the because those cells have to replicate. And most of the regeneration occurs between month 3 to month 8 and up to a year. Okay.
My name is John Lindquist. I'm 59 years old. I'm a union carpenter for 39 years, on my feet pretty much for the entire time that I'm working. 18 years ago, I twisted up and hurt the meniscus on the inside of my left leg. Been suffering with pain for that duration. Came in 6 weeks ago and got the injection in my left knee. Instantaneously, it felt like pressure came off. And after 6 weeks, I'm about 80% to where I get through the day and I forget I even have a knee. It's been fantastic, and I'm glad I came.
So you don't have to be a super athlete, folks, to receive stem cell therapy for joint regeneration. It's perfected, and it's done right here in the United States, and it can be done to you.
He was 92, and he wasn't doing too well, and I took him to the Mayo Clinic in Arizona, and they said, "You better leave him here. He's going to be dead." And I'm like, really? So they kept him there 10 days, stabilized him, identified a number of problems, just wearing out, the kidneys, he had some congestive heart stuff and lung stuff, and various other things. His hip was, hurting. He was not ambulatory, and he was in a lot of pain and pretty listless and sick. Night, what do they call it? Night terrors, or where he wasn't quite lucid. But all this stuff was draining his energy and affecting his mind, and it was the full kind of old indignity, the 92 years of age. So I figured, if he could just get his hip under him and get moving again. And they said, well, you shouldn't really. He's pretty old to be doing an operation like that. The recovery it'll take so much for him to recover. He'll probably that might take him out. I'm like, well, we can't do that. And then my brother said, look, why don't you try? I got this website of this like adult stem cell thing. I'm like, what adult stem cells? Yeah. So, and we shot him in the hip. And they thought they had to do 2 hips, so they had enough for 2 hips, but it was so much. But they put double the amount in 1 hip, and then of course they just dropped some into his bloodstream, like 100 million cells or something like that. So, but every ailment that this man had kind of righted itself, and pretty quickly too. And he started walking without pain, and he became back to his lucidity, and his kidneys were okay, and his heart and his lungs, and his eyesight got better, and he even started getting little pigments in his hair and stuff. It was insane. He's almost 99 now. He's been down 3 times, and almost 99. I did it on my shoulders, and cut to 2 years later, I'm doing my shoulders, and the doctor who was skeptical is there getting his knees done because he wasn't walking too well. So we're both late 50s. So, or back then we were in our late 50s. I'm a little older than that now, but it's I think it's pretty miraculous, what it was able to achieve for the old man, and he's still going. 99 in August. So he got 7 years out of from this stuff. When they told me at the clinic, you don't leave him here, he's going to be dead in 4 days.
Did I hear a rumor that he actually demonstrated a moonwalk on his subsequent birthday?
Oh no, he was fooling around. He was he was pushing the nurse in the wheelchair and doing all. He was goofing off. He got a big kick out of that. He got pretty. He got a lot back.
Well, I was intrigued with the thoughts of stem cell therapy. I didn't want to do something that was going to be wrong, so I did a lot of research, and I was confident that this was something that was really going to help, because I know that the body can rejuvenate and repair itself if it's given the right conditions. And so I thought stem cells were the way to go. I didn't have a lot of terrible pain in my knees, but I was getting there. So when I had the stem cell injection, I looked for several things. I looked for the improvement in knees, maybe something in my eyes. I've got a lot of floaters. My eyes are always tired, they always hurt, and I was looking for maybe some help with depression. I found out that my knees are incredible. Even though the injection didn't go into my knees are incredible. I can bend them, I don't have any pain, I don't have any clicking noises. My ankle was hurting. My ankle's tons better. My eyes are not as tired. I'm not sure what we're going to do about the depression, but I am just so grateful that there's an improvement in my knees, and that's great.
The pain is practically gone. I just occasionally have a few little pain. If 4 weeks ago I was wandering, but here we are almost 8 weeks out, and if progression were to stop today, I'd be totally as happy.
That's awesome.
Yeah, I mean, it was well worth the money.
Awesome. Now, you said you didn't miss a day of work.
Did not miss.
But how did you modify, you said about the lifting the chains, will you demonstrate that for me again, please?
Yeah, I could always lift my arm this way. I could just go like that
Right.
until I felt pain or something, and then I just take this arm and just hook
So
it on
you
my
were
equipment.
able to work,
Every day.
even though we did this injection, you didn't miss a day of work, you just had to modify how you were lifting
Yeah.
chains.
Right.
That's awesome, man, thank you.
Oh, you're welcome. Thank you.
I do drywall, acoustic ceilings, metal stud framing
How long have you done that?
for 49 years. After 9 shoulder surgeries and 7 shoulder dislocations, there was so much pain I could hardly sleep at night. So
All in your shoulders,
my shoulders and lower back.
okay? So when you first came here, how high could you lift your arms above your head?
Not very far. I was having a lot of trouble at work.
Okay, so here we are 8 weeks later. Lift up your arms for me. And what did you just tell me that you can do now that you couldn't do 5 years ago?
I could not lift my track fast guns. They're fairly heavy. My screw guns I had no strength. I had to use both arms to do my work. And I've just in the last 5 weeks, I've realized that I have no problem doing it. I don't even think about it. It's just coming back to me. And no pain at night.
Your pain's pretty much been gone since injection day, has it not?
Yeah, the first couple days, all the pain went away and I started sleeping like a baby.
And now 5 weeks in, strength's coming back.
The strength's coming back and hardly any pain at all. And I'm doing the work way faster than I've ever been able to.
That's awesome. That makes me happy. Thanks, man.
Yep.
So my number one complaint was the osteoarthritis in my knee.
Yeah.
My right knee. I had been diagnosed with osteoarthritis on the inside of my right knee, and just the bone on bone. And in my work, I walk a lot, so it was always hurting. When I'd sleep at night, it would hurt, and I just wanted to try something. Because they said the only option I had was a knee replacement, and I'm only 40 years old.
40 years old, your only option was knee replacement.
Right.
And what do you do for a living?
Pest control and lawn care.
40 years old, you guys have 6 kids,
6.
and they told you you're self-employed, the best pest control business in the business,
True.
and your knee was the only option was to replace it.
Right. That's what I was told.
Okay, how's the knee today?
No pain at all. I haven't had any pain since our 6-week checkup the week before that, so it's probably been about a month. Yeah.
So overall total, how long ago did the injection happen?
It's been about 3 months. No, over 3.5 months.
So 3.5 months ago.
Yeah. Yeah. And no, it was real good in the beginning, and then it kind of fluctuated, a little pain here.
As everybody's does.
Right, and it's just getting better and better and better. I really haven't had any pain at all since then.
What would you say to the skeptics?
Try it. Don't knock it till you try it.
That's awesome. Thanks, Tom.
Yeah.
So, Steve, you basically were told by the surgeon that neck fusion was in your future.
Yes.
And what did you say to that?
I told him no.
How come?
I drive professionally. I've had a commercial license for over 48 years.
Mm-hmm.
And when he told me that there was no chance of me keeping my commercial license after I would have my neck fused, I said no.
So here we are, we're 5 or 6 weeks.
Roughly 6 weeks.
About 6 weeks after an injection into your shoulder and into your neck.
Right.
What's different now?
I can move my neck more freely. I don't have quite the grinding and the popping that I did. I've had virtually no headaches.
What were you telling me about your sleep?
And my right arm would just go to sleep almost immediately. If I slept on my right side, my arm would just go to sleep.
Okay.
And it would wake me up. It would be to the point where I couldn't even move my hand. Now it doesn't do that.
Awesome. You told James about this, right?
Yes, I did. Every once in a while I have a little knot, feels like here, if I reach up high and back, but I see that slowly diminishing.
And we're just 6 weeks in.
Just 6 weeks in.
Awesome.
I am just elated with the results that I'm seeing.
Awesome. Thank you.
Yeah.
So let's talk about investments in stem cell therapy. Folks, what you're really paying for is mobility and independence. It bothered me greatly to see my father, who worked his tail off raising 6 kids and looked forward to his retirement, and he could barely walk around. So I wish this was available when he was alive. I always say mobility and independence. What else do we buy that gives us mobility and independence? A car, right? So 4 body parts, that would be like, 2 shoulders, 2 knees. 4 body parts, the investment is $18,800. When we order that many cells, we get a multiple body part discount of $3,000. We pass that on to you, the patient. And if you've watched this video in its entirety, whether online or here, you will get a $400 seminar discount voucher. Those of you who are watching online, please mention it. And that brings it down to $15,400 for 4 body parts. 3 body parts is $14,300. Again, a multiple body part discount of $2,100. And again, mention that you have your seminar discount voucher of $400, and that brings the cost down to $11,800. 2 body parts is the one we see most common. So again, there's a small multiple body part discount for 2, that's $1,200. And a seminar discount voucher if you mention it to the staff. So that brings down 2 body parts to $8,200. So there's a company called Care Credit that we use, and if you have decent credit and income, you can finance this. $8,200 for 2 body parts. That would be up to 12 months interest free. The payment would be $684 a month. Up to 60 months with interest, $208 per month. Now, if you are watching this and you're here today and this is for your lower back requires enough cells for 2 body parts. But what we also do for lower spine is after the injections, 8 weeks after the injections, I offer, included in this fee, up to 12 spinal decompression treatments. When we do this and then 8 weeks later, decompression treatment for people with degenerated lower back discs or herniated discs or stenosis or spondylosis, it is an amazing combination. 1 body part, 1 knee, 1 hip, $5,300. Seminar discount voucher of $400, cost is $4,900. So you can do Care Credit on that. Up to 12 months would be interest free, and that would be $409 a month. Up to 60 months, $125. So what's next? Here's how I like to do this. We have you scheduled today for a 30-minute consultation, or if you're watching this online, you can call our number and schedule a 30-minute consultation for $75. You're going to mention that you have the $400 voucher, and you're going to fill out paperwork before the appointment. Now, what's the consultation all about? Number 1, I'm going to answer all questions that you have. Number 2, I'm going to discuss areas of your degeneration and whether or not you need these certain areas. Look, folks, I only recommend stem cells done on joints that are badly degenerated. If I think there's a less expensive, more efficient way of helping that area, then I'm going to recommend that to you. For example, we had a lady come to me with bone-on-bone right knee, and she's walking like this on her knee, and all of a sudden her left hip is bothering her. She comes in thinking she needs to get both done. I suggested no. Just do the right knee, because when you start walking more appropriately, you're going to take the pressure off that hip, and then we can just give you at-home exercises for the hip. Again, if you're going to do a job, do it right. Do right by people and be honest with them. So we're going to talk about cost options at this consultation, and I do like your spouse or significant other to be there, because what I don't like hearing at the end of these consultation is, oh, I have to go home and talk this over with my spouse or significant other. That's why I like them there. And oh, by the way, if you decide to go ahead and have the procedure done, usually we can schedule you within a week, and we will also take the $75 off that you paid for the consultation off the total cost. I love this quote right here: pain is inevitable, suffering's optional. So we have one trip around this thing we call life. How would life be if your knee was working better, if your hip was working better, if you avoided surgery, if you could do more things with your time and enjoy life? That's one of the biggest thrills I get, and I get passionate about this when I see people 8 weeks into it or even later, and they're able to do things. I get so much joy out of that. I'm Dr. Ed Beyer. Hope you enjoyed the presentation and hope to see you soon.